Greetings, everyone. This is Terry Naturally with another edition of Terry Talks Nutrition. We're here every weekend, same time, same station. You can't lose us. If you're here now, you know where to come back. And if you have friends, family, relatives, whatever, and they don't know where we are, you do though, you can tell them where we are on Terry Talks Nutrition. We present the science, the education, the knowledge. How can you become healthy? You know, we are eating the wrong diet. All of America is eating the wrong diet. The U.S. dietary guidelines that was presented in 1977 put us on the carbohydrate ride. They recommend like up to 12 servings of grains and cereal, all the carbs. Now all the carbs have caused all of our diseases. If you're fighting and suffering from any kind of disease, more than likely it's not a disease. It's a vitamin or nutrient deficiency. It's too many carbohydrates and sugar, which causes insulin resistance, insulin sensitivity, and a really high blood level of insulin, a high blood level of sugar. It's just not the sugar, it's also the insulin. So you have a high level of a hormone that produces fat and stores fat. And that's what's wrong with America. Take a look at all the pictures. I've seen them on Facebook of all the pictures in the 1960s that look so healthy. They're at a beach, all slender, all in good shape, all physically fit, all on the healthy side. And then in the 1970s, we started the obesity ride. Let's go back and eat what we ate in the 1960s. And what was that? Protein, fats, meat, butter, cream, whole milk. We ate all the good things, and we were all healthy. And then the 1977 guidelines that was presented by the U.S. Agricultural Department of what we should eat was all carbs, because they made us fear fats for no reason. There's no evidence whatsoever that saturated fats cause heart disease. Absolutely. Guaranteed. And that's not my opinion. That is the truth. There's no evidence whatsoever that fats are bad for us. Now I'm talking good fats. I'm not talking about seed oils. I'm not talking about hydrogenated oils. I'm not talking about the synthetic oils. I'm not talking about the bad oils. All fats are good. Meat fats, good for us. Bacon, good for us. Butter, cream, lard, bacon grease, olive oil. All these fats are good for us. And we need to include them in our diet. Lower the carbohydrates. Now, if you have a medical condition, and you need to switch to a low-carb diet, like if you have epilepsy, if you have mental disease, then you need to be on a really good medical ketogenic diet where your carbs are down to about 20 grams of carbs daily. But you don't have to go that low for everyone. Dr. Wolfgang Lucht, a German physician who no longer is alive today, he lived to be 97, and in his 40s, he was so crippled up with arthritis and diabetes that he said something is wrong. And he found out that the carbohydrates that we consume today was too high to allow us to have good health. And he got all of his 10,000 case studies down to 72 grams of carbohydrates a day. And some of the top scientists that also present information on low-carb diet, they have their recommendations down to 50 grams of carbohydrates a day. And the US guidelines is over 150. And I think people are up to over 300. It's killing us. Carbohydrates and sugar is killing us. Not overnight, slowly, 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 so you don't know it's even happening. And then you end up with inflammatory diseases, rheumatoid arthritis, osteoarthritis, heart disease, high blood pressure, dementia, Alzheimer's disease, brain disorders, all kinds of metabolic disorders. Only because we are eating the wrong diet. It's not the lack of drugs. You can't make enough drugs to cure what we have. And they're not the best anyway, because you always have side effects. Don't let anybody kid you. We're on the wrong diet. You can't put bad fuel in your car and expect it to run correctly. But we are putting the wrong fuel in our bodies and we expect it to work. It can't work. You got to put the right fuel in our bodies to make it effective. We need whole food, natural food, unprocessed foods. 70% of Americans are on a diet of ultra-processed foods. We are killing ourselves with our diet. We're not unfortunate. We're not unlucky. God's not mad at us. We are just on the wrong diet. We are choosing the wrong food to eat. We're making bad choices because we like what we're eating. We like the sweet taste. And we don't want to change. Well, if you don't want to change, then you have to suffer. You have to face the consequences of your illnesses. You don't have to be ill. You don't have to be sick. There is no such thing as type 2 diabetes. It's just another name for high blood sugar level and a high insulin level, insulin resistance, insulin sensitivity, excessive high levels of insulin, which causes many of our diseases. So, type 2 diabetes is optional. I heard a doctor say you can't reverse it. Yes, you can. I've seen it over and over and over again where people change their diet, lower the amount of sugar, lower the carbohydrates, and completely, in some cases, avoiding sugar entirely. You can do it. If you want to be healthy, it's your choice. If you don't want to be healthy, that's also your choice. I don't make choices for you. I just tell you what the evidence is. You have to follow the evidence and make the choice. And I try to bring you the best evidence I possibly can. You don't have to suffer. You don't have to be ill. You don't have to have high blood pressure. You don't have to have type 2 diabetes. You don't have to have a high blood sugar level. You don't have to have cardiovascular disease, which is caused by all these conditions. Now they're trying to change, in 2015, they're trying to change the diet to more fats, good, healthy fats. We need fats. Protein and fats are essential. We can't live without proteins and fats. We can live without carbohydrates. We don't need 1 gram of carbohydrates to be healthy. And some people are eating up to 300, 400 grams of carbohydrates because of all their sweet taste. Lots of sugar. 16 teaspoons in some of the coffee drinks. It's crazy. You don't need all that sugar. You don't need all the carbohydrates that eventually convert to sugar in the body. You don't need white flour. You don't need white sugar. You don't need rice, grains, cereals, pasta. You don't need all those. They're very high in carbohydrates, and they eventually convert to sugar in the body. That's the way they're metabolized. You don't need carbohydrates, pure and simple. You don't need 1 gram. You don't need any. There is absolutely no essential carbohydrates. There's essential proteins. There's essential fats. No essential carbohydrates at all. All right. Let's go on with our topics of the day. So, we're going to help you to cure urinary tract infections. That's on the docket today, our featured topic. And really, is dementia real? Alzheimer's disease real? Now, here's a check-in. Are you taking a daily multiple? And now allergy season will be coming up. Can you survive an allergy season? And here are some quick tips for natural headache remedies, headache reliefs, guaranteed to work. And why sleep gives you a healthy heart. And a closer look at high-density lipoprotein, the good cholesterol, so-called the good cholesterol. They're all good. Cholesterol is good for us. It's just that one lipoprotein brings cholesterol to the cells, and one lipoprotein, the LDL, takes away the cholesterol. They're all essential. We need cholesterol. We can't live without it. Our cells are made out of it. Our vitamin D is made from it. All of our hormones, essential hormones, are made from cholesterol. I think, boy, I'm coming close to think that somebody is trying to upset the apple cart. Ultra-processed foods cause polyps in the colon. And people are dealing with polyps. And they're being cut out. You know, folks, all of our, absolutely, it drives me crazy. Because I read so much. I read 2 or 3 books a week. I read books on what scientists are saying today about the American diet. And why our food, carbohydrates and sugar, are so damaging to our body, to our health. And we can just turn that around. You don't need a drug for everything. Now, I'm not saying there aren't needs for drugs. There are some kinds, in some cases, where we do need a drug, or some person needs a drug. I'm not against drugs. I'm against the overuse of drugs. Drugs for everything. Watch TV. They try to blindside you about everything you need a drug for. It's like you can't live without drugs. Drugs take you through this world. Drugs are killing you. And there are so many side effects to drugs that you need more drugs to eliminate the side effects of the drugs previously. This is a crazy world where the food manufacturers and the drug companies have screwed us. Literally. They have damaged our health. And there's no way you can't sue them. Nobody's got enough money to try to sue them. And drug companies are just probably, they don't have any way to be sued. They go through with a free pass. It's so sickening. I just get so upset. Well, okay. Let's do a little bit of work. What about urinary tract infections? Most commonly, they are a bacterial infection caused by E. coli. And the conventional treatment is antibiotics. Urinary tract infections, or otherwise known as UTI. And UTIs can be especially dangerous for older adults. Antibiotics, prophylactics, no symptoms. Oh, but take an antibiotic anyway to prevent infections. That's crazy. If you don't need an antibiotic, don't take it. And if you got a cold or flu, antibiotics don't work because a cold and flu is caused by a virus. 98% of the time by a virus. Antibiotics kill bacteria, not viruses. And antibiotics are not recommended as it leads to antibiotic resistance. Then antibiotics don't work anymore because we've used it so many times, the body can't get value out of it. Now, what you want to do, you want to prevent a UTI. So how do we correct prevention? And what is involved for preventing UTIs? Well, first of all, stopping bacteria from colonizing the urinary tract. Keeping urine and the urinary tract acidic, a low pH. It sterilizes the urinary tract, kidneys, and bladder. Now, the ideal nutrients to do this: cranberry, acidic, and has some polyphenols that will neutralize and prevent bacteria from forming in the urinary tract. And another nutrient known as D-mannose. D, just the letter D, mannose, M-A-N-N-O-S-E, D-mannose, and vitamin C. Why cranberry? It is an antibacterial directly for the urinary tract. And the mechanism of action for these key nutrients and constituents, the antibacterial effects, quinic acid, and other organic acids in cranberry are very antibacterial. Also, polyphenols that I already mentioned in cranberry block bacteria, harmful bacteria, from adhering to the bladder wall. And patients with neurogenic bladder due to brain, spinal cord, or nerve problem decreases by 60% in UTIs. Women with acute UTI treated with standard antibiotics or cranberry. Here's a study, science. They used antibiotics on one group of patients and cranberry on the other group of patients. And cranberry worked better. Twice as many participants reported feeling very well versus the drug group just after 7 days of treatment. And here's more evidence. Because evidence shows the results. We just can't make a prediction. But supplementation with cranberries reduces the overall risk of UTI by 30% in both men and women. And what is D-mannose? It's a monosaccharide. It's a simple carbohydrate. And it prevents bacteria from adhering to the bladder walls. And that's where it makes a home. And it starts growing. And the mechanism of action prevents bacteria from sticking to the bladder walls. So the bacteria is washed out by the flow of urine. So D-mannose prevents bacteria from sticking to the bladder walls. Studies show that versus placebo, a fake pill, results in double the reduction of bacteria in the urine and 4 times the reduction of bacteria in the bladder. You know, if this was a drug, because you can't patent cranberry and D-mannose, you can't make this into a drug. But if this were a drug, it would be hailed as a miracle for UTI, urinary tract infection. In women who had experienced a previous UTI, 4.5% had a reoccurrence within 6 months while being treated prophylactically with D-mannose versus 33% of women who received no treatment. Only 4.5% in the treated group with D-mannose, where the women that were treated, or I should say, who did not receive any treatment, they had a recurrence of UTI by 33%. Huge compared to using cranberry and D-mannose. And then vitamin C. It acidifies the urine. It raises the pH of the urinary tract and urine. So the mechanism of action for vitamin C is directly antibacterial, lowers the urinary tract pH, and here's evidence. 12% of women that were pregnant receiving supplemental vitamin C, 100 milligrams daily for 3 months, experienced a UTI versus 29% of the untreated group. So the relative risk reduction of over 50%. Administration of vitamin C to patients with alkaline urine, meaning over 7, 0 to 7 is acidic, 7 to 14 is alkaline, so this is over 7. Alkaline urine pH over 7 resulted in a decrease to more acidic urine. That means a pH under 7. Some authors, some scientists, feel this effect is better described as preventing alkalization rather than inducing acidification. Vitamin C's antibiotic activity is effective even if the bacteria are resistant to antibiotics. That means when antibiotics don't work, vitamin C will work. Now, just exactly what do you take? Here's the formulation I recommend. Take a combination of 500 milligrams of cranberry powder with D-mannose and vitamin C daily. This is a combination of 3 ingredients, all combined in one formulation, and works better for urinary tract infection than drugs. You have a better recovery. If there's a reoccurrence, it's much, much, much less than those that were not treated. This is really the way to treat urinary tract infections. So, whatever you decide to do is your choice. I don't make the choices, I present the information. I bring you reasons why you might want to make a choice, and you say to yourself, well, why should I make a choice? Where's the evidence? I'm bringing you the evidence. These are studies that shows that 500 milligrams of cranberry powder, along with D-mannose, a monosaccharide, and vitamin C daily, will prevent, reverse, cure UTI, and absolutely no side effects. Now, whether or not you accept this as choice, or you want to talk to your doctor, and I always like to say, if you're not sure, talk to your doctor, of course. I don't leave the doctor out of your choices. You should get various opinions. I'm giving you my opinion. Well, I shouldn't say my opinion. I'm giving you the science why I should think that this is a a reasonable and a logical choice. So that, my friends, this is down to the half hour. We're going to take a break here, a short break here. Don't go away. I'm not going anywhere. We're going to come back here right on Terry Talks Nutrition. And we're going to be here to the top of the hour. We'll bring you more information. And really, is it really dementia? Or what is it? We'll talk about that as soon as we come up here after the break. So don't go away. I'm not going anywhere. I hope you don't either. Stay right where you are. We'll come back right after this. Welcome back, my friends. We're back with Terry Talks Nutrition. I'm the host, Terry Naturally. I know you're listening to our program for an hour, but if you go to my website, Terry Talks Nutrition, there you can listen to all the radio shows that we have archived there for you. Have you missed a show? Or do you want to listen to the show over again? You can do that with dozens and dozens and dozens of radio shows. I write a newsletter that goes out every Friday to your email address. It's on health and nutrition and how you can treat yourself. You can subscribe to it on terrytalksnutrition.com, my website. You can also read all those that have been archived on the e-newsletter section of the website. So you can read until the cows come home. You can listen to the radio shows over and over and over again. You've got so much information there and so much being put on the radio show section, the e-newsletter section, and the entire website. And at the present time, we have over 300,000 subscribers to the newsletter. So be another one. I would love to have you join. Now, let's talk a little bit about dementia. Is it really dementia or not? Or is it something else? Every year, there are more than 10 million new cases of dementia diagnosed globally, around the world. 10 million cases. However, estimates by experts, as many as 13% of cases, that's over 1 million people, have been misdiagnosed. Why? Maybe we'll get to that. And their mental symptoms are due to some other treatable cause. And diet is one of the causes. I follow a medical physician. She's a board-certified psychiatrist, Harvard trained. And she has been treating many of her mental patients with the ketogenic diet. There, with the ketogenic diet, for treating mental disease should be where you lower the carbohydrates to about 20 grams per day. And if you cut them out completely, it's okay too. But if you're generally looking for good health overall, and you don't like the idea of facing arthritis, systemic inflammation, high blood pressure, obesity, cardiovascular disease, all these conditions can also be treated with a low-carb, high-fat diet. Low-carb, high-fat diet, moderate amount of protein. Folks, you may not even believe it, but I've talked to so many people that have made that decision to get rid of the sugar, lower the carbs down to somewhere between 72 grams to 50 grams. Not entirely, but really lower it. That's about a third of what the USDA recommends. So this is a way to correct many conditions. But with dementia, which has been misdiagnosed. And their mental symptoms are due to some of the treatable cause. What are some of the treatable causes? Liver disease. When the liver is not properly filtering out the waste and toxins from a bloodstream, it can actually cause mental symptoms, including confusion. With liver disease. Urinary tract infection, which we just covered. Urinary tract infections. In older adults, a urinary tract infection can cause mental changes without the fever and burning on urination that are common symptoms in younger people. And then dehydration. The thirst mechanism in older adults isn't as strong as younger people. So dehydration can cause confusion, fogginess that can be mistaken for dementia. Make sure you check that out. It's something to really realize that you could be misdiagnosed if you aren't including some of these nutritional tips to make your body more healthy. I'm just going to check in on you. Are you remembering to take a daily multivitamin and mineral supplement? Why? Well, a new study, a daily multiple, slows aging. Chronic aging is how old you are in years. Biological age measures the wear and tear on your body at a cellular level. So researchers used a special test to compare biological aging between people who took a daily multiple vitamin for 2 years versus people who did not. And you're going to find that people that took at least a daily multiple fared better versus non-vitamin users, people that did not use a vitamin supplement. People who took a daily multiple aged more slowly. Biologically, they aged about 20 months to 2 years less. They were 4 months younger than the people who didn't take a multiple. Here's how to find a good daily multiple, which contains a full range of vitamins and minerals at more than 100% of the RDA. RDA, recommended daily allowance, is what you need to prevent a full-blown nutrient deficiency, not what you need for optimal health. Nutrients are for everyone. You don't need an age vitamin. Oh, this is for adults. This is for teenagers. This is for kids. Now, for kids, maybe I would think about a lesser strength multiple vitamin and mineral supplement. You don't need it for men and women. Whoever makes the dinner and serves the meals, I'm sure they do not make a meal for women and a meal for men. Everyone at the table eats the same, in most cases. And in this case, nutrients in their most optimal forms for better absorption and efficacy. Active forms of B vitamins and chelated minerals. Minerals are very hard to be absorbed. But when they're chelated, it's like the claw of a lobster. And if you insert something in the center of the claw, it's chelated. There's something surrounding that object. And when you chelate a mineral, the mineral is inside the chelated complex. So look for a natural formula free of toxic ingredients like BHT, artificial coloring, artificial flavors. And absolutely no gummies. Who wants to eat candy? That's really what they are. Gelatin, a lot of sugar, artificial flavoring, artificial coloring, and you think that's making you healthy? That's a bad food, a bad supplement. So no gummies. They absolutely frequently contain sugar. And many times high fructose corn syrup, the most damaging form of sugar. Artificial coloring, and very, very low on vitamins and really, really low on minerals, especially iron. You can't get that much in a gummy. I've seen good formulations of curcumin at 750 milligrams per tablet or capsule or soft gel. But in a gummy, the most it could get in a gummy was 38 milligrams. 38 milligrams. And it was just as expensive as the 750 milligram soft gel. Go figure. They know you're going to pay it because you want a gummy, because you want to eat your treat. Now, allergy season, not far off. What are you going to do about it? How are you going to survive allergy season? Well, 25% of Americans deal with seasonal allergies due to trees, grass, weed, pollen, and mold. And why do we have allergies? Well, when you come into contact with something that is foreign to your body, and it's when an oversensitive immune system tries to protect you, your immune system is trying to protect you from something that is not actually dangerous. Histamine is the specific compound released by the immune system that causes the allergic reactions, like coughing, sneezing, watery eyes, and itching are all allergy symptoms. Antihistamines that are often sold as drugs to stop histamine release, but they also have side effects: drowsiness, dry mouth, constipation, dizziness, headache, and blurred vision. But now there's better choices naturally. 2 natural compounds that can help with allergies without adverse effects. No side effects. One is called Pluron. It's a compound that's found in oyster mushrooms. It's spelled P like Peter, L like Leonard, E like, pick something out, URAN, PLEURAN, Pluron. Pluron is a fibrous material that is broken down in the intestinal tract that boosts the immune system, or I should say modulates the immune system, because modulation is much better than boosting, because you don't want to boost your immune system. Some people who have like rheumatoid arthritis or MS or MG, all those kind of conditions are caused by overstimulation of the immune system. You want a compound that modulates or balances the immune system. So Pluron from oyster mushrooms and a bioflavonoid called quercetin, Quercetin, quercetin. These are 2 natural compounds that can absolutely favor the reduction of allergies, the prevention of allergies, and lower the overstimulation of the allergy. Now, if you want to reset the immune system, modulation, fluoride from oyster mushrooms helps to regulate the immune system. Regulate. That means if you have an overstimulated immune system, it corrects it. If you have an underactive immune system, it corrects it. So it balances the immune system to not overreact to something that is not dangerous without interfering with the ability to neutralize dangerous pathogens. Also reduces blood levels of specific compounds that trigger allergic reactions. Fluoride needs to be taken every day, ideally before the start of allergy season, so the immune system is in a condition and position balanced before the pollen starts. In clinical studies, 100 milligrams of fluoride with 100 milligrams of vitamin C reduce upper respiratory tract illnesses in children with allergies and asthma. Very, very safe. No known side effects. No adverse events. Very safe for kids. I would say, I don't think there is a level of concern. So it could be a very small child. And this is so simple. Just 100 milligrams of fluoride from oyster mushrooms with 100 milligrams of vitamin C was able to reduce upper respiratory tract illnesses in kids that had allergies and asthma. And it's very, very safe. And to reduce histamine, quercetin is a natural plant compound that is an antioxidant, reduces inflammation, and blocks histamine release. And where do we find histamine? Onions, peppers, kale, dark berries like elderberry have lots of quercetin. I would be a little bit careful with elderberry. These were scientific studies, but I would be very careful with elderberry because elderberry can boost the immune system and not balance the immune system. So quercetin has been shown to inhibit histamine release by up to 97%. You don't need to struggle with allergies if you start the allergy season off right. And here's a clinical trial. This trial was done in adults with seasonal allergies. 4-week treatment with quercetin reduced allergy symptoms, and those symptoms are itchy eyes, runny nose, by 30% without side effects. And also, I would use fluoride from oyster mushrooms and quercetin together. Fluoride should be taken daily on an empty stomach. It needs to reach the special receptors in the gut without food. Food prevents these special compounds to be available, these receptor sites available for the fluoride to be effective. So food interferes with how fluoride interacts with immune cells in the intestines. So 100 milligrams of fluoride with 100 milligrams of vitamin C for adults and kids. Now, I think that's a really good dosage for kids. For adults, I probably would double that. So if you find a formulation with a serving of 100 milligrams of fluoride with 100 milligrams of vitamin C, that's plenty for kids. But I would take 2 servings for adults. Now here's a bonus. This will also help protect you from bacterial and viral infections. Isn't nature good? Nature is there for us. But we don't stop to use nature. We want drugs. But drugs have side effects. Drugs don't work as effectively. Natural ingredients work in concert with your body. And quercetin, I love it. It's ideal for all types of lung and respiratory problems, asthma, allergies, COPD, infections, and more. And the type of quercetin I would use is one that's mixed with gamma-cyclodextrin. Sounds like very chemical-like compound, but it's a starch. It's natural. It's not absorbed by the body. There's no calories. It's just a vehicle to transport quercetin to the bloodstream, to boost absorption. And also combined with 250 milligrams of vitamin C. The best way to approach allergy season. Now, would you like to hear a little bit more about natural medicines for headaches? I would like to offer you 3 solutions for headaches, all backed by science. When you have a headache, how do you lower the pain of the headache? With a combination of curcumin and boswellia in black sesame seed oil. Works quickly and as effectively as over-the-counter drugs to relieve pain. Take 1,000 milligrams of the combination once or twice daily or when needed. To prevent migraines, and even if you have a migraine, it'll reduce the effects of the migraine. CoQ10. Clinical trials show that CoQ10 can cut the number of hours a migraine lasts by 50%, while also reducing the severity and the frequency. The one I always recommend is the 100 milligram chewable CoQ10. The chewable one is bound to gamma-cyclodextrin, and it's 8 times more effective. So you're not taking 100 milligrams, you're taking 800 milligrams in the absorption of the material of CoQ10. And to prevent hormone-linked headaches, DIM, D-I-M, helps improve estrogen metabolism, keeping it from being converted to harmful metabolites, which can cause migraines and other hormone-related symptoms such as PMS and even cancer. How much DIM do you need? About 120 milligrams daily. So CoQ10 is one of the solutions for migraine headaches. And for the pain of the headache, a combination of curcumin boswellia emulsified with black sesame oil and DIM, D-I-M. Do you need all 3? I throw things out there. These are all scientifically documented. They're really very effective. They're very safe, really no side effects. But do you need all 3? Maybe not. But I give you the choice of 3. One for pain, that's the combination of curcumin and boswellia. CoQ10 and DIM. DIM usually helps those headaches that are involved with hormone-related or hormone metabolic function. You can use all 3. There's no side effects using all 3. You might choose one. And if it doesn't work, then you know there's a second or a third choice. And with that, my friends, my time is up. I hope you do some of these things to make yourself healthy. Remember, there's nothing more healthy for you than the right diet. It's your choice. Choose a diet that is moderate in protein, high in fats, very, very, very low in carbohydrates, and absolutely no sugar. Now, maybe you won't reach those levels now, but keep working at it, and you will. And that, my friends, say a prayer for this crazy, crazy world. God bless you. And God bless this wonderful, crazy world.
Thank you for listening to Terry Talks Nutrition Weekly Show. Don't forget to subscribe and leave a review on your favorite podcast platform, including Apple, Google, and iHeartRadio.